Welcome. I'm Cheryl Mitchell. I'm the president of Tree Levin, which is a retreat and learning farm here in Addison County. And we also are thrilled to partner with Building Bright Futures to get to know what supports are available to families with young children in our community. So today it's my pleasure to be interviewing Holly Laramee, who's the Director of Maternal and Child Health for the Vermont Department of Health here in Middlebury. Welcome, Holly.
Thanks for having me.
Thanks for joining us.
Yeah, happy to be here.
So I'm wondering if maybe you would start with just talking a little bit about the 18 million different things that you do.
A lot of them. So I always like to start with my role is I'm a public health nurse. So within the Vermont Department of Health, we have district offices throughout the state, and each district office has designated public health nurses that work on specific areas. So in our office in Middlebury here, we have 3 different public health nurses. Really 4. One's in a supervisory role, and the other 3 of us, one does school health and epidemiology, the other one does immunizations, and I am specifically maternal child health. Doesn't mean we don't dabble in all of the other areas, but my role is a very broad, very specific to each town and what the town needs, but I work in all different areas with partnership with community partners on things like children integrated services, Fostering Healthy Families, which is a program that helps children in foster care get medical needs.
Oh, let's come back to that in a minute. Okay.
Yep. And I work with things like partnership with WIC and helping in projects Safe Sleep education. I work with CSAC sometimes on some projects, Building Bright Futures as part of a member of their group. A lot of work on affordable childcare and childcare access. Tons of different things. And it's a realm that I didn't know that this job existed until I was in it. And yeah.
Can you tell, you're a nurse?
Yeah, I'm a nurse.
Can you tell us a little bit about how did you come to be here?
Yeah.
Did you think you would be a hospital nurse, or what was your history here?
Yeah, so nursing was a second profession for me. I took the very long road to become a nurse, all community colleges in Vermont, and did it later on in life. And I didn't know exactly what I wanted to do, but once I started to do hospital nursing, I was pretty sure it wasn't for me. I think this is actually the best fit for me overall, but it took me some time to get here. I really wanted to be part of a community access, whether that was VNA or school nursing or something. I really wanted to be embedded in the community, and I think hospital nursing is too, but in a different way. And so this job is really perfect. But I went the long road. It took me a bit to get here, and I was in clinical nursing in a OBGYN office in Burlington for 7.5 years. Mm-hmm. And when I had my son, I realized I really wanted to take a little bit of a step back from the really busy clinical role, and this really was a good fit for me to be here. So, yeah.
Cool.
Yeah.
Do you live in this county?
I live in Ferrisburg, yep.
Uh-huh.
Yep. I lived in Burlington. I grew up in Vermont. I grew up in southern Vermont, and then moved to Burlington when I was 18 and was there on and off for, 12 years or so. And then when we were looking to buy a house, Ferrisburg was the place to be. So live there. I have a 20-month-old son. My husband and I live there. And and so that's the other thing.
How are you balancing having such a young child?
Not easily. I think, which is really helpful. I mean, it's opened my eyes to the experience of being a family in Vermont and how difficult childcare access is, and balancing work and having a family and doing it all is hard. I think in some ways the pandemic has helped us because I'm able to work from home sometimes. So that's helped me on days when my son needed to be home, and that was a lot of the time last year during the middle of the pandemic. But it's been great. I've enjoyed it, but it's definitely given me a better understanding and empathy for what it's like to be living in Vermont and having young children, because access to childcare is really, really hard, and it's not affordable. So here we are, and I have a front seat in experiencing that.
Cool.
Yeah.
It's nice to have somebody in your role who's had that broad experience.
Yeah.
So let's jump back to something that you mentioned earlier,
Yeah.
which is the fostering families. Is this a new program?
It's not. It's actually been in partnership with VCHIP for several years. Essentially, what it ended up being was part of an act within DCF, our Department of Children's Family, that there was a nurse that worked in the public health department that specifically helped DCF when children enter into custody. And so what we do is that anytime any child that enters into custody in Addison, I get notification of that, just as the pediatrician's office does, or the primary care. And we work to make sure that they've gotten their medical needs met, so they've been seen by a provider, hopefully recently, but then even if not recently, getting them in within 30 days of entering into custody, getting them in with a dentist, getting them in with a mental health provider, making sure their child care is aware, and connecting the foster family with the provider's offices, so they know their allergies, their medications, when their appointments are, so they're not missing anything. So really establishing that when they're in custody with us in our county, that they're getting the best care that they need at that time. And so it's been a really, and we're working on some projects with the pediatrician offices to kind of expedite that process to make sure that kids are getting in pretty quickly after they enter into custody. So we're doing a little bit of tweaking of how they're notified and how do we get people in, even in busy provider schedules. And so that's been really rewarding, and it's been really lovely to work with the foster families in our community that are doing such great work.
It's so exciting because years ago when I used to work for the state, kids would get moved into foster care, and the foster parents wouldn't even be told who the child's pediatrician was. And often people were, being moved around dramatically. So it's lovely. It's getting more
attention.
More attention and smoother, it sounds like.
And it's there's no reason for a foster family to not know what the allergies are when they first get enter into custody. And then even if as they transfer hands very often. So they might be in one home for a couple nights or a week, and then they transfer into another home, and it's sort of my job to kind of make sure that the next family knows about those medical needs. And then that record kind of sits with us, and we get to keep it. But it's really a report to the case managers at DCF, so that they're aware as well, and they don't have to kind of deal with the medical jargon and figuring out why the medication's being used. It's sort of my job to help with that. So it's a great partnership, and it's great to be able to work with DCF. As you know, we're sitting in the same building.
Side by side. Well, upstairs,
downstairs.
Okay.
Yep. But it helps for us to just kind of know where everyone is and what the needs are of our community. And so that's just one snippet of my job, but then there's a ton of other things that I do.
Could you talk a little bit? I mean, I think when people traditionally think about public health nurses, it's you would go out, to what home health often does now. How that works? You were mentioning that you know all the towns now, and
so that was my impression too. And usually when people ask me what my job is, and I say I'm a public health nurse, they just think I go to homes, and that was kind of the role of a public health nurse before. And now we're more of an administrative role that's connecting partners and sort of seeing the gaps that are needed in our community, and how can we bring people together to the table to fill those gaps and to work together to fill those gaps. And so in terms of the immunization role, it's again, through COVID, which is what I was doing. I was doing the IZ role until we hired somebody. It was organizing community clinics, organizing school clinics, making sure that pediatricians were aware of what needed to happen for individuals in the community, a lot of education. And still, even in this role, it's sitting at the SIS table, or Children Integrated Services table. It's connecting with the pediatricians about a promotion that's happening in the state that we're trying to promote. It's resource building. It's such a diverse role. And it's a little bit, at least in mine, kind of what you want to make of it. So it is us going around saying, what does the community need? What I work for you as the community member in this public health role, and how can I help to facilitate projects that need to be tackled? So some of the things we're working on is how do we get referrals through systems that are taxed right now, low staff, and how do we make sure referrals come through? Working with labor and delivery, and so it's a little bit what you make of it. And we all work together in all the district offices to kind of collaborate on who's doing what in their district and how we might be able to tweak that and work it here. And
So you had mentioned a couple of campaigns.
Yeah.
Like Help Me Grow and
Yeah.
Back to Sleep. Do you want to talk
Safe
a little bit?
Sleep. So Safe Sleep has been
it's
around
called
for a
now,
long
right?
time. Yep, the maternal child health coordinators have been doing safe sleep training in childcare centers, in labor and delivery, I'm trying to think of where else, within WIC. And so the Safe Sleep campaign is a national campaign that we foster it we promote it within the state to talk about safe sleep guidelines in childcare facilities and also at home. So back is best, and nothing in the crib for the first year, making sure infants are sleeping in the same room with their parent, and kind of really reducing the risk for SIDS or any unintended.
Wow, so that's the infants sleeping in the same room with their parents. Is new, certainly from when I was raising kids.
Yeah, yeah. So the idea is that, and I was just talking about it this morning actually with the WIC team, was that the promotion around that, and this is all based on AAP guidelines, so the American Academy of Pediatrics, is that they want them to be in the same room, so that kind of constant stimulation for infants is that minor arousal that kind of gets them out of their deep sleep cycle, which they do most of the time anyways because they wake up to get feed, but that really fosters a good connection with mom and baby or parents and baby, and also allows them to kind of be on that sort of surface level of arousal to keep their reduced risk for SIDS, so they kind of stay somewhat more alert. And so that's part of the reason that we kind of encourage that safe sleep guideline of being in the same room, not in the same bed, in a nice safe sleep environment, but in the same room. And so and there's a ton of other ones, there's a ton of other ones around that about safe sleep practices, and making sure that they're in approved safe sleep environments. So, a non-inclined sleep bed, nothing in the bed. You can use a sleep sack, no weighted sleep sacks. And so I've done that with Parent-Child Center. I've done some trainings on it and can offer it up to any childcare facility too if they're trying to do education for parents or just education for staff in the infant room in the childcare centers.
So are you the main link with childcare programs and health
practices? For
other things as well?
Yeah, so that could be for illness, guidelines for building illness protocols, and then also, any kind of legislative programs and sort of kind of working with Building Bright Futures or Let's Grow Kids, of being a partnership with all of those programs. So, and I'm still learning. I mean, I am still new. I've been in the role for about 1.5 years, and the childcare industry in all of the state, but in the community, is really, really strong, and they've been doing it forever, and as you know, and I'm learning and adapting and finding out more information every day.
But I'm just thinking about the amazing role of and connections between the healthcare, public healthcare world, the pediatricians and the child care programs when COVID came in, and people just didn't know what to do, and there were regular meetings and a great source of information. I'm also curious, did you train the people? So we had to take our grandchildren sometimes through the I think of it as the hot chocolate booth over by the rec department to get COVID testing. Was it the health department doing that, or did you?
We did it they did it at the Legion prior to me starting, and then we did it a little bit at Middle Road, but I kind of came in right at the time when we were doing school-based clinics, so which was similar. I mean, it was a similar thing. And our role as the public health nurses there is we do vaccination, but oftentimes we were taking on volunteers from the Medical Reserve Corps. They were doing the shots while the public health nurses were really drawing up the vaccine, reviewing paperwork, making sure everything was running smoothly, and sort of being the leads at those clinics.
Wow. I've not heard, I don't think, of the Medical Reserve Corps.
And I'm not the best person to talk a ton about it, but because we have a group of people in our office that facilitate that group, but they are volunteer nurses, pediatricians, doctors, EMS providers that are all trained medically, that really are there in case of an emergency, and COVID was an emergency. So they were taken on to volunteer hours to do mass clinics. And so they really were there for the front end testing at the beginning, and then sort of when I came on, they were there to help out with the vaccinations clinics in the schools. So they were the ones that were doing the vaccinations long hours and were phenomenal, and they were old, retired pediatricians and nursing students, and so many people that got involved.
Yeah, well,
Yeah.
I remember Judy Shaw from VCHIP
Yep.
when she was getting ready to step down from VCHIP, saying that's what she was going to
Yeah.
do next. And wow.
Yeah, yeah, and it was such a cool way for me, having been in Chittenden County working, but living in Addison County,
Yeah.
to get to meet the community members that were doing it. But they were our rock stars. I mean, they really showed up, and they were always, even when you'd be like, we'd put a shout out to say we need someone to come help at Leicester School or, Orwell, and, 20, 30 people would volunteer when we only needed like 10, but they would they were there, they wanted to do it, they were really excited, and they came with a smile on their face every day, and were, the kind of the calming energy in a school clinic, and it was really, really great to have them. So yeah, and they're still there. They still volunteer, keep their membership active, so that if anything came up in the future, any kind of emergency, they're available. And that's our emergency preparedness coordinator in our office. Beata is the one that keeps that relationship going. Yeah.
And I think you also talked about Help Me Grow.
Yeah.
Can you say a little
Yeah,
more
so
about that?
Help Me Grow is a state funded promotion referral system. I don't want to say promotion, it's not the best way to put it. Campaign. They are a offset branch of 211, which that works specifically with young families to get them connected with the referral services within this community first, and then statewide. So it could be anything from someone needs some assistance with food access and connecting with WIC, or they need childcare, or they need housing, really anything. The family can get referred either by a provider or a WIC nutritionist, or they can do a self-referral and reach out to Help Me Grow. That is a case manager that would say, what's going on? What are you looking for? What do you need help with? And they connect them to those services. So it's another, outside of our community-based referral systems, it's another opportunity for the state to help out. And they keep this kind of crazy database, just like 211, that if a family is looking for services in Addison County, they keep a database there, and then also for every other county in the state. Yeah. And so it's another great way to get resources to people. So and then kind of offshoot of that again too is another program called Support Delivered, which is helping families with perinatal and perinatal depression and anxiety, and not only just helping patients access care, but also helping providers in terms of resources for them. So if they have questions about medications or questions about how to treat a family, they have access to it. So yeah, those are all state-run programs that I'm still learning about, and it's a lot. It's a lot to take in from a clinical role to public health if you're not trained.
I'm curious,
yeah.
how have you transferred all your clinical skills
Yeah.
into this, which doesn't sound as hands-on at all?
Yeah,
So
it's not. I have, in the sense that I have this different perspective, because when we come up with these kind of ask of the pediatrician offices or labor and delivery of how to do something, or we're sitting at a table to talk about how we're going to start a new process, I really have a very different lens coming from a clinical background of knowing how busy clinics are, knowing how busy providers and nurses are in those offices. And sometimes a small ask to us is a really big ask to them. And so that's that. And then also there's the clinical skill of having worked with women for, almost a decade, and knowing the complexities of women's health and how amazing women are.
and
how much
labor
we go.
and delivery nurse at one point?
I wasn't. I was an OBGYN nurse. Yeah, so I worked at Maitri Healthcare for Women for 7 years as a triage nurse, and then a clinical manager, and then transitioned into this role. So very busy clinic with a lot of really great expertise and skills. But yeah, was ready once I had my son to take a step back from the long hours and be home with him a little more.
Yeah.
But it's kind of crazy how it's come full circle, because all of my experience has really led me to this role. And I wasn't just really ready to leave my clinical role unless it was something that was a really good fit for me. And this was the right, it just was all of my things.
Did you just open the paper and there was this job, or did
Kind
somebody
of.
call you up and say,
Yeah,
hey,
when I was, sorry to interrupt you.
go
No,
ahead.
when I was in nursing school, I had seen some of these jobs pop up in public health in the MCH world, whether it was in Burlington or here. and knew it was on my radar, but was sort of like, well, I'm not ready to really leave this fast-paced clinical space yet. And then when I was ready, I was ready. And I happened to just be on maternity leave, and the job popped up, and I knew someone that worked at the Middlebury office. And at that time, I thought it was like dozens of people working in the Middlebury office. So I just didn't really know how public health worked. And I connected with Jillian, who worked at WIC.
Oh, yeah.
And she told me a little bit more about the position, and it was like meant to be. It was just so, I was very, very much like 2 months postpartum with my son, and took the interview and was just so ecstatic to be here.
Oh, perfect.
Yeah. And really excited to be working in a Vermont community in a much more in-depth way, having grown up in Vermont and gone to Vermont public schools. And so it just is it's a great fit. And there's still so much to learn. And
So from what you know already,
Yeah.
which is a huge amount,
Yeah.
are there areas that you wish we were paying more attention to?
I mean, all of them.
Yeah.
It's hard to stay focused sometimes when there's so much need. But the childcare one is kind of a big umbrella one, because without, places for families to put kids affordably and safely and feel supported as a family, all of the other things are sort of, it's a trickle-down effect. Because if a new mom can't figure out where to get her newborn or her young child into school so she can go back to work, then, perinatal or postnatal depression and anxiety is at an increased risk for not having those support systems in our community. And so a lot of it is all trickles down to that, in my opinion.
Yeah.
So that would be my biggest area of focus, is how we can do that.
Can I ask a personal question?
Yeah.
So how are you dealing with it? Do you have a caregiver?
Yeah, so my child's in full-time childcare in Charlotte.
So
yeah.
you're driving north?
To then coming
but
south.
You don't have to drive all the way south.
Yeah, so
anymore.
2 days a week I'm in Middlebury for work. So I drive all the way to Charlotte, drop my son off, and drive all the way back to Middlebury. And I'm not too far, but it's a little bit of a transition. We had him originally at Little Tots in Ferrisburg, and then transitioned to him being in Charlotte. It's an incredible financial burden, but it's worth it in the long run. I mean, it's like a college for your toddler.
Yeah, totally.
And I'm trying to remind myself that we all, have to make sacrifices sometimes. But yeah, and hours have been shortened to accommodate low staff that are in those facilities. And so that's a burden on us and stressful. But, I think we've all in COVID have come to adapt the best we can and know that we have to just function. And, I have a great employer that's super accommodating to workers, which without them, I would not be here working. I think that they've just been really, really flexible, and knowing the climate of what we're in, that they have to be in order to keep people employed. But it's not easy. And I think we brought this up at a meeting recently that I would love it if my parents could be here and help out, but they're not retired yet and they're working. And, it's crazy to me that me and my job, and my husband and his full-time job, that even us, with financial means, they're still struggling. It's still a struggle. And
my daughter's child is just about the same age as your son, and they went through the same thing.
Yeah,
so, but fortunately we're right nearby.
Yeah.
So there is family support around, and not everybody's got that.
No, and you understand why people move close to family now. You
Right.
get it. You get it. But Vermont is tough that way. And we similarly were on when in the middle of it, we couldn't look at any of the centers when I was pregnant because it was COVID. So we really couldn't even tell what we were putting ourselves on the wait list for, whether it was a center we wanted to be in or was it something we felt comfortable with. It was kind of just throwing it to the wind and saying, I guess it will work out, And so it took us about almost a year and a half to get him into Charlotte Children's Center, which has been phenomenal, but it took us a bit to get into that space. And the value of it pays off. I mean, he's just in the best of hands, and he's growing, this time frame. We know this. We've done the research. We know that the first 5 years is so critical for their development, and you see it every day. He's in such a good learning environment, but it's really hard for me knowing that I get sort of this great spot, but not everybody gets that based depending on their income levels and their means. And so, offering up more universal pre-K and education to staff and support for centers is really, really important. So I sit at those tables of those meetings and I'm in awe of everybody doing this hard work, and I'm still, again, learning. But I fully support them and wish that I could do more, and will do everything in my power in my role to help support it.
We're thrilled, Holly,
Yeah.
that you're here and part
Yeah.
of this community.
Yeah.
And we're going to run out of time
Yeah.
in a minute, so I'm wondering if there are things you'd like to talk about that I have
Oh
not
gosh,
asked.
I think I usually spit it all out, but no, I think that's it. I think I'm just really fortunate to be a part of it, and so thankful to be here in Addison County with such great supports. And yeah,
I think
thanks
we
for
all
having me.
are.
Yeah.
And I just want to say, for people that are listening, Holly's contact information is going to come up. I think you're willing to take phone calls, emails,
anytime,
whatever, if you want more
yeah,
information about anything that's going on. Our public health office is super,
yeah,
I think.
yeah. It's a good team. It's
Always has been
Yep.
and still is.
yeah,
so
very good team.
That's great.
Yeah.
Cool.
Yeah, thanks for having me.
Thank you.
Yeah.
And for those of you that are listening, if you have information you'd like to get out to the public, I really encourage you to call up Middlebury Community Television. They're awesome. And if you don't know what you're doing, they know. And they'll help you look good. And Darla Senecal, who's our BBF regional coordinator, has just walked in. She's the producer of these shows. She's waving. She's not on screen, but just want to let you know that she's there. Thank you.